We're keeping an eye on Tropical Storm Andrea, the first named storm of the 2025 Atlantic hurricane season. It just formed this morning, but is expected to weaken and fizzle out by tomorrow night. There is no threat to land. Tim called it a nothing burger earlier. So though the storm not a big deal, Andrea does serve as a reminder to finalize hurricane preparedness plans now that we're officially in hurricane season.
And with that, Marta Berglund heard from a pharmacist on how to make sure you have medications and health supplies ready in case of an emergency.
While we talk a lot about emergency preparedness kits this time of year, medical professionals remind us to pay extra attention to medications and health supplies.
Specialty medications deal with complex disease states. It's very important for patients not to miss any doses, even in the event of an emergency.
Walgreens local pharmacy manager Justin Fernandez says those specialty prescriptions usually treat conditions including cancer, multiple sclerosis, and arthritis.
These medications are just as important as having a plan for food or water. So we want to make sure they have a plan of how they're going to obtain these medication and continue on therapy during a natural disaster.
That plan should include knowing how to properly transport medications. For injectable prescriptions, Fernandez says to make sure you have a sharps container and alcohol swabs. For managing diabetes, make sure to have a spare insulin pump. Also, prepare a cooler for medicine that needs to stay refrigerated.
We do recommend like a battery-operated cooler, just because that will be able to maintain its integrity for a little bit longer than ice packs. If an ice pack cooler is needed, it's just really important to drive in, not to place your medications directly on that ice pack because it can cause them to be frozen.
Fernandez adds it's crucial to notify your pharmacy if you're leaving the area. Be sure to let staff know where you're relocating to, even if it's temporary. For 13 News Now, I'm Marta Berglund.